A new measure in law has some reforms coming for the health insurance industry in the state of Illinois. Governor J.B. Pritzker signing a bill yesterday that he advocated for in his State of the State speech, and it brings about reforms to health insurance. Things like getting rid of pre-authorization, getting rid of step therapy, allowing for insurance to give more money to those seeking emergency mental health services. So a variety of things in this measure, and it was a bipartisan measure. You had even some insurance groups saying that some of these things could be workable, but all of this obviously coming at a cost to taxpayers, and those taxpayer costs we'll touch on here in a moment. But again, yesterday the governor in Chicago signing the Healthcare Protection Act, and does a whole host of things. Some of them kick in January 1st of 2025. So what exactly does this do? Again, it gets rid of step therapy, it gets rid of pre-authorization, but only for Illinois managed health care insurance policies. And these particular policies, for instance, really are those that have insurance for state government workers and public sector workers, the like, that have insurance policies regulated by the state of Illinois. Here's Governor J.B. Pritzker and Senate President Don Harmon yesterday talking about this particular bill.
For thousands of Illinoisans, the reforms in this bill will mean the difference between, suffering with curable health conditions and getting the care that they need in a timely manner. And for some, this bill will quite literally save their lives.
Today's bill signing is the culmination of a massive effort on the part of our colleagues, Governor Pritzker, and advocates. A massive effort to put into law something that seems like it should be common sense. Health insurance companies should be focused on making people healthy. But somewhere along the line, priorities got out of whack. Instead of helping patients find the best care for their individual needs, the focus too often shifted to maximizing profit.
So the bipartisan bill passed, but not without substantial questions. And it was brought up in the House earlier in session, and it was discussed, and even the costs were raised as an issue. State Representative Ryan Spain, a Republican from Peoria, asked the bill's sponsor, Anna Moeller, a Democrat from Elgin, I believe, who sponsored the bill, and she answered the questions of how much this costs, but also, does this impact the health insurance for immigrant adults and health insurance for immigrant seniors, the health benefits programs, HBIS and HBIA. And this is the hundreds of millions of dollars in taxpayer subsidies going to pay for the health insurance of non-citizens in the state of Illinois. Here's some of that back and forth in the House.
And so I wanted to clarify your legislative intent. And my question to you is, does this bill make any changes to the benefits of the HBIA or HBIS programs?
No, this bill does not affect those programs at all.
Does this bill have any bearing whatsoever on either of those programs?
No, this bill affects the Medicaid program, but as you know, those are Medicaid lookalike programs and therefore do not affect the program offerings or details of those plans.
And you can tell how important this measure was to Governor J.B. Pritzker, because you see him there in the House chamber during debate, looking on at the sponsor, and there he is right there, looking on to the sponsor as the debate happened when this passed the House the first time. But it had to go to the Senate as well. But before that, there were questions about the costs. State Representative C.D. Davidsmeyer in the House raised those concerns about how much this is going to cost taxpayers, especially with the insurance being regulated, that type of insurance being had by state employees.
I want to reiterate the concerns that I have that, as you said, the HBIA and HBIS, the programs for non-citizens that are here, you said those mimic Medicaid.
They're not connected.
But would not be covered by this.
Correct. They're a Medicaid lookalike program.
Okay.
So
I still have concerns that it could be, because I think sometimes we try to stretch that within our department, so I certainly have concerns about that. Ultimately, I think this is going to be a large increase to the state of Illinois. I think it's going to be an increased cost to taxpayers, because the majority of our taxpayers will not be covered by this. And with those concerns, along with the illegal immigrant population, I want to say I will be a no on this. So I do appreciate your work.
So again, passed the House, and there was bipartisan support, and then it went into the Illinois Senate, where State Senator Dave Severson asked State Senator Robert Peters how much this is going to cost taxpayers.
What's the estimated cost for implementing this plan on working families in Illinois?
Senator Peters.
The estimation from the governor's office is 50 to 60 million.
Senator Severson.
Okay. And what was the cost estimate from the industry? Do you remember what that one was?
Senator Peters.
We did not get a cost estimate from the industry. I would like to add that the industry has removed their opposition from this bill. I would just like that to be noted in the record.
Senator Severson.
Thank you. I'm not sure if they didn't have much of a choice, but
So again, the Democratic supermajority, with some support from Republicans, passing this measure out of both chambers as amended in the Senate and then out of the House, where the governor then signed this yesterday with an estimated taxpayer cost of upwards to $60 million, and still questions about is it going to impact the health benefits for immigrant seniors and adults. So some of the legislation, again, the governor has 400 bills remaining on his desk last I saw, and you can imagine that a lot of those bills are going to be signed throughout the summer, and we'll keep you updated on all of that here and the impact to you, the taxpayer, here in the state of Illinois. It is Illinois in Focus Daily. I'm Greg Bishop. Thanks for being with us each and every weekday morning. Again, Illinois in Focus Daily. Like, subscribe, and hit that notification bell with America's Talking Network for Illinois in Focus Daily.